The nurse cares for a patient hospitalized for 5 days with pneumonia. He is about to be discharged and the nurse is providing discharge instructions to the patient and the family. Which statement made by the patient's family should most concern the nurse? A. He can stop taking the antibiotics when the symptoms are gone. B. He still has to use the incentive spirometer to keep his airways clear and open. C. He can eat normally but we have to make sure he has a nutritious diet. D. He can start doing his chores when he feels better, but shouldn't overexert himself and should rest a lot. E. He should stay away from other sick people because his immune system is still weak. The answer is A. He can stop taking the antibiotics when the symptoms are gone. When a patient has an infection and is prescribed antibiotics, the patient should always take the full course of the medication and never discontinue the medication. It is easy for patients to believe they can stop taking the medication when the symptoms are resolved, but the nurse needs to educate the patient to continue the full regimen. The rest of the statements are accurate. The patient must get adequate rest, eat well, use the incentive spirometer, and stay away from others who are sick until he is well. A 2+ radial pulse is considered to be dash. A. A normal pulse. B. A bounding pulse. C. An absent pulse. D. A weak pulse. The answer is A. A normal pulse. The following scale applies to the amplitude of a pulse when palpated at the radial artery. 3+ is an increased or bounding pulse, 2+ is a normal pulse, 1+ is a weak pulse, 0 is an absent pulse. Which of the following locations is most appropriate for assessing the pulse of an infant? A. Carotid artery. B. Brachial artery. C. Radial artery. D. Popliteal artery. The answer is B. Brachial artery. The most appropriate location for assessing the pulse of an infant is the brachial artery, which travels from the axilla down the ventral surface of the upper arm to the cubital fossa. The popliteal and radial pulses are difficult to palpate on an infant due to their size, and the carotid artery can be difficult to palpate due to an infant's shorter, thicker neck. Which of the following is a normal adult respiratory rate? A. 11 breaths per minute. B. 9 breaths per minute. C. 16 breaths per minute. D. 22 breaths per minute. The answer is C. 16 breaths per minute. Normal adult respiratory rate is 12 to 20 breaths per minute. A respiratory rate below 12 is defined as bradypnea, while a respiratory rate above 20 is considered tachypnea. What is a normal respiratory rate for an infant under 1 year of age? A. 30 to 60 breaths per minute. B. 20 to 30 breaths per minute. C. 10 to 20 breaths per minute. D. 60 to 90 breaths per minute. The answer is A. 30 to 60 breaths per minute. Infants have the highest respiratory rate of any age group. A normal infant respiratory rate is 30 to 60 breaths per minute.